Welcome back to KimFood.com. This is Dr. Kim. We like to talk about surgery today. I know we all don't want to talk about surgery because we don't want them. However, sometimes, and not too often though, less than 5% of the time, you may have to consider surgery now. In our office, we're able to do less than 1% of our patients go into surgery. So we're pretty successful at doing all the different modalities and treatment plans, but we still need to talk about surgery in case you need them. So basically, what happens during the surgery? What we're doing is, remember the plantar fascia that's like this? We don't cut through the whole fascia though. What we're doing is we cut through about 2/3 way down. And then what I do is I stretch and cast it in that position so that it opens up the gap there to lengthen this plantar fascia. Because most people have a very tight plantar fascia that's causing the problem, so that it lengthens the area to heal the area. Also, this area becomes fasciosis with the degenerating cells there, and by cutting through it, it starts the inflammatory process again to get this area healed again through the surgery. So that's what we do. There's several different ways to do surgery now. One of the most common things that most people use is called extracorporeal shockwave treatment. Now, this is a high energy sound wave that they put in here to try to revive and restart the inflammatory process. I've tried it myself. However, unfortunately, in my hands, it doesn't work too well, so I don't do that particular procedure. But there's still a lot of qualified doctors who are performing this type of surgery, so you should definitely look into this particular way of doing the surgery, because there's really no opening, and then the shock wave is from the outside, so it's a very effective way to improve the condition. And second way is the open technique. This is a common procedure that are done, and making a pretty large incision and looking at the whole plantar fascia and cutting through it. And obviously, opening is a very good way for the surgeon. However, it takes a long time for the patients to heal, so this particular procedure is not what I usually use. And then the third way is called the endoscopic plantar fasciotomy. Now, endoscopic meaning using a arthroscopy procedure to make a couple of holes on either side and go inside and look at the fascia visually and then cut through this area. It's a very good technique. I've used it quite a few times. However, it's very equipment intensive. It takes a lot longer than what I usually like, because I want to get in and out from the surgery. So it's very equipment heavy, so I don't do this particular procedure anymore, but it's a very popular procedure that are performed by many doctors right now. And the next one is called the minimum incision technique, which is the technique that I've used, that I've created and developed over the years now. What I do is I make a very small, tiny incision, probably less than 5 millimeters or so, and I look through the fluoroscopy, the live x-ray, and I know exactly where to cut, so I just make a little cut through that area, and I make a little suture into the area. It takes me less than 5 minutes, very effective. Patients have absolutely no pain afterward, and I make sure cast it in the proper way to open up the plantar fascia so it heals nicely in a lengthened position, and also it restart the inflammatory process. So it's a very effective surgical technique. So it's something that we don't want to do, but if we have to, this is a very effective surgery to do. So these are the surgical procedures that are available out there. You want to pick a good doctor who are board certified and who's done a lot of these surgical procedures, be able to really help you with this, because we all want to avoid surgery, but if you do need it, you want to be as least amount of invasiveness as possible, as well as quick of a recovery as possible. So that's what I wanted to talk to you about today. So on the next video, our final video, we're going to talk about how to prevent the heel pain epidemic. We'll see you there.